Hi, I'm Megan Kingsley Gale. I'm here with Sondra Abanto, who has her MBA and is a performance management, has been working in performance management for a long time. Here to answer some questions you guys have, and we'll explain a little bit more about onboarding when you're a new employee, what to expect with orientation and all that. So a little bit about Sondra and I. So I met Sondra about 5 years ago when I was at Madigan and she worked at MedCom. We worked on some metric stuff together. And so as luck would have it, 5 years later, here we are in the same area again. So we're taking advantage of this opportunity. Yes. Sondra has graciously come over to come talk with us at the Hospital Handbook Project about performance metrics, which is a really complicated topic, and you have a lot of experience in it. So Sondra's been working in performance management for over 10 years. She, from NIH to DoD, Army, and Navy, she's worked in performance metrics, and she has her MBA, but you might not know she's actually has 3 years of acupuncture school as well. So she's been working with her MBA for over a decade now and is going to share some of her special knowledge about performance metrics with us, or performance management. So if you guys have questions, go ahead and put them in the chat as we talk, and we'll get going. All right. So Sondra, we're going to talk about the onboarding process. Like, what are the rules of the game?
So the great thing about going with an established organization, a large hospital, DoD hospitals, is they typically have a robust performance management plan. And when you come on board as a new civilian or as a contractor, et cetera, they are going to onboard you. And basically that runs the gamut from doing all your paperwork to learning about the organization, the culture, their expectations. Typically, in addition to your paperwork, that's the time when you'll do your performance plan. You'll meet with your supervisor and you'll go over the organization's missions, their goals, and how you fit into that big picture.
Okay. So it's important to know, like, if I'm a new employee in a hospital, I need to know what my organization's mission statement is, not just my clinic's?
Correct. And so, especially in the federal government, also in the corporate sector, you're really looking at the 40,000 foot view of what that organization is trying to achieve. What's their mission? What are their values? How do they go forth in servicing patients and clients? And then if the organization has a robust performance plan and onboarding plan, you'll see exactly how you fit into that and what your role is in supporting yourself, your colleagues, your supervisor, all the way up to the organization. So everything should flow up and down, and it should be all synchronized.
Okay, so I like how you talk about this with flowing up and down, like Correct. Vertical and then horizontal.
Yes.
So is this the time to explain more about that, or maybe later?
Either way. So, okay. One of the things that typically is done in onboarding is they kind of set the groundwork for the organization. So it could be things as simple as, how do you dress for a professional environment? Because everyone's perception of what acceptable attire is could be very different. So for example, if you're wearing stilettos in a clinic setting where there's a lot of spills and there might be hazardous cleanup, maybe not the best thing. If you're going to a business meeting, that may be fantastic. Making sure you don't wear open-toed shoes. So there's tons of regulations about what is a functional wardrobe and what is a professional attire and everything in between. So, those are some of those things that if you've come out of school or you've come out of private practice, you really didn't have to worry about those so much. But typically in an organization, it's codified very well, and they're very strict about what you're going to wear and why that's important.
So when I'm a new employee, they should be giving me like a code of conduct?
Correct.
And possibly a dress code?
Correct. And so typically what will happen is your HR specialist will call you in and they'll tell you where you should report to. If it's an organization like the military, they may even assign you a sponsor that's going to help you get onto the base, or if it's a secure hospital, they may have areas where you can't just access it on your first day because you may need your credentials. So typically your sponsor or your HR representative is going to be the person that brings you in, and then you'll sit down and you start going through all that paperwork that you need to get you started. Your code of conduct is going to be in there. They may have you sign ethical statements. You may be bringing in transcripts, official transcripts, because oftentimes if you apply for a job, they'll take unofficial transcripts. So this may be the time where you actually have to deliver the official transcripts. Mm-hmm. So that whole bolus of paperwork is part of that onboarding process.
Okay. I know in my experience with working in hospital, the credentialing process took really long time, like a minimum 4 months.
Yes.
I've heard some people take 6 months, depends on how backed up the credentialing department is, but they go through not just your resume, but you have to have peer contacts, and you had to have people at your previous job, people who could verify your clinical work.
Yes.
And that it was okay. And they double check your national provider database to see that there's no dings against you for malpractice, and they check your malpractice insurance providers and multiple malpractice insurance providers. So it's a pretty intense process. And then there's all the HIPAA training and the privacy training, and getting your ID badge.
Yes.
So do you want to talk more about that?
Yeah, absolutely. So again, government and private sector are not too different, but basically you'll need access to systems because you're going to be accessing sensitive patient information. You're going to be accessing certain databases so that you can enter in patient records. All of these things are going to be tightly controlled. And so your ability to access these systems and start doing work is dependent upon you completing mandatory training. A lot of that training is how do you handle sensitive information? How do you communicate things as simple as lab results? What's the proper method for communicating with patients, with relatives? So all of these rules and regulations that govern privacy information are going to be strictly codified, and you must learn those like in the back of your hand, because you never want to be in a situation where you are divulging information that's highly sensitive or highly valuable, or both.
Yeah. So first day of the job, I should be going through some kind of employee orientation.
Correct.
With my clinic and or the actual hospital facility. Right. So if that doesn't happen on my first day, within what period of time should I expect these it sounds like different types of training, like not just so general hospital training, how to use the computer system training, and then my specific clinic training. That should all happen within what period of time?
Typically, you're looking at 30 to 60 days.
Okay.
It can vary depending on, for example, if you're in the government, there are certain pieces of data that have to float to certain systems in order for you to be issued a CAT card. Same thing in the
CAT card is a common access card. CAT card is a common access card, which all federal employees, anyone who works in a federal facility has to have that to be able to use a computer.
Yes.
So it's one of those things you want to protect behind an RFID blocking wallet.
Yes, absolutely.
You don't ever have those display when you have a photograph taken of you either. They're very sensitive ID, special kind of ID card.
Absolutely. And so the common access card, in addition to allowing you to gain physical entry to your hospital, your clinic, or your workplace, they also, for the majority of cases, allow you to access your computer systems. And so if you don't have your common access or your CAT card, then you're not able to work in terms of being able to record patient encounters or charting or entering information into databases. So typically onboarding is going to take anywhere between 30 to 60 days. And that really is dependent on what information needs to go to what HR systems, and then how those are fed to actually be able to issue you your ID and your credentials once you're on board. I would say the government sometimes can take a little bit longer, just because the amount of training that you're required to have when you first onboard, the information you need to issue a common access card, it's a lot, and it can vary from agency to agency. I think with the private sector, with the focus oftentimes, not all the time, but the focus on the bottom line, the profit, there's a little bit more sense of urgency to get people on board right away.
And start seeing patients.
Correct.
Okay.
Correct.
Okay. And so, okay, I'm trying to make sure I'm not forgetting something. Do anybody have questions out there before I don't see any questions popping up yet. So, we talked about enterprise level vision, hospitals. Did we talk about this? Hospital's mission statement, your clinic mission and vision, and how they all
kind of tie together.
What's an ideal? So if I'm working at a hospital that's part of, I'm working at a hospital that's called Hospital A, and it's part of the BAC system of healthcare. I'm trying to not use real examples, obviously, but BAC healthcare has a mission, and then my hospital A has another mission or vision statement, and then I might be part of the wellness center inside of there. So in an ideal world, my position at the wellness clinic, how does that all correlate back to that system's mission, vision? What's a good example of it?
So for example, if you work for a large healthcare conglomerate, let's say, multi-hospital system corporation, and if you think of it as an umbrella, basically everything that's under the umbrella is going to be your 40,000 foot view, and the handle of the umbrella is where you fit into the organization, what you can impact directly. And so there should be a clear line of how the mission and values of that organization go all the way down to the personal level. So everybody in that organization should know how what they do in their job contributes to goals. And it's oftentimes referred to as cascading goals. So basically you start from the most broad mission of that healthcare organization and you go all the way down to the personal level. And regardless of whether you're a clinician, you're an admin, you may be in information technology, everything that you do, in theory, should support that overarching goal of that organization. And in addition, it should also be related to your performance plan. So you also have this horizontal purview where you say, how do I fit into this? And if I want to grow with this organization and continue to support the mission, what do I need to do in terms of education, internships, externships, special assignments that's going to help continue to grow me as I progress along my career. But it should be obviously clear as you're going through the onboarding process, who you are and how you fit into that organization and how you directly support that overall mission.
Okay. And in theory, like that would even be written into my position description.
Absolutely. And so you have to think of your performance as this giant holistic system. And so everything, if you want to talk DoD specific, you're talking about, you have a position description that explains what you're expected to do and how you're expected to do it. And then that's going to feed into your performance management plans, typically an annual cycle of taking information from your position description and then giving you ways to measure how you're doing and how you're going to meet and achieve your goals that directly tie into that overall mission, that overarching mission.
Okay. So like if my mission, if I work at a hospital and the hospital's mission is to say, provide great patient care, and it's something that has to do that in their mission statement.
Which is very broad.
It's very broad, which is often the case in large hospitals. So but at my wellness clinic, they might be like, well, we're going to provide great patient care by teaching patients self-care, as well as providing a way for, like, say, if they're coming in with chronic pain, provide a way for them to be treated and out of their chronic condition while teaching them self-care stuff through Tai Chi, through yoga, through breathing exercises. Right. So we give them tools, self-care tools for them to go out and practice, but we're there also to support them to get to that place where they can do their self-care. So I'm making this up on the fly, guys, so sorry about that. But okay, so something about my specific position description as an acupuncturist, like teaching Tai Chi, ties into the wellness clinic, which is about helping patients learn and practice self-care. Correct. And that statement somehow leads into being patient-centered, the large hospital model. Okay.
Absolutely. And down to when you get to your position description, it should actually say your big picture vision at that corporate level, and then go down to your clinic level, and then go down to you specifically. So for example, you are benefiting patients and enabling them to conduct self-care by conducting yoga classes or by treating patients or teaching patients how to eat properly, how to eat for, let's say, their element type, if they're, if they subscribe to 5-element acupuncture theory. So that
individualized nutrition plan based on their differential diagnosis.
Yes. Okay. And so that should all be part of that performance plan. Not only that, but it's also going to show you what you're expected to do and then what the impact of that is. And so, for example, if you're doing instructional work in self-care, then there should be an outcome directly tied to that performance bullet or that performance metric or that performance item.
Okay. Can you give an example of that?
Sure. So, for example, if you have let's say we have a backlog of patients that want to come in for addiction therapy.
Okay.
And so you've been hired on to do all types of treatment through acupuncture. And so your specific performance plan may say that you're going to help assist in the treatment of patients seeking help for dependency issues. And then it may also say, this is how many patients we expect, a reasonable expectation of how many patients would help that organization start to dwindle down that backlog.
So there might actually be a number of patients per month.
Correct.
Something.
Correct.
Okay. All right. And then the onboarding process that you mentioned provides a framework for what is professional behavior.
Yes.
Okay.
Yes. So we got off track, which I often do, but because I love performance management. And again, it's a continuum. It's, it's not linear, but, in terms of onboarding and professional behavior, and it ties in with these ethics, it's basically showing what right looks like for the organization that you work in. So for example, if you work in,
let's say that again. I like how you said that. Showing what right looks like for your organization.
Correct.
Okay.
And it can vary from organization to organization. I mean, you may go from Army to Navy. Mm-hmm. You may go from DOD to a non-DOD entity. And so things that happen at a clinic in NIH may not necessarily be acceptable in a non-NIH clinic. And so you really have to, this is part of culture and part of the onboarding process is tell me what I'm expected to do. Tell me how I'm expected to interact with patients and clients and family members. And what is the culture that I'm working for say is appropriate and what's not appropriate. And, do I have any leeway in that? And so that should be part of your onboarding. And that should be a really candid, open and honest conversation with your supervisors. And part of that also is just, acclimatizing yourself to the new culture.
So a lot of learning about culture. So a professional dress, I think we talked about that at the beginning, like having if the organization has a code of conduct, you should be able to get a copy of that.
Correct.
You might even have to sign it. And then probably a dress code if they have a dress code. And those are all ways for the organization to to tell you about their culture. Correct. And what they expect from you.
Yes.
So the other expectations, like how about work expectations, orientations? What should, in an ideal situation, what should they be telling you?
Basically, they're going to tell you kind of what the ground rules are, or for example, if you play baseball, that you can hit the ball and you can go to home plate if you can, So what are the rules of the road? What are the ground rules? And so, for example, you want to talk about when are you supposed to clock in? When are you supposed to clock out? How do you do that? Do you use a time and attendance system? Are you on the honor system? Things of that nature. Again, this is where sponsors are invaluable because the sponsor will basically take you under his or her wing and show you how to do the mundane things like signing into a time and attendance system, because that could be, a trigger for a supervisor.
Okay.
So these things don't seem very exciting, but they're critical to making sure that you are onboarded properly and that those little kind of silly details don't get in the way of how you're perceived as an employee.
So having a sponsor. So in theory, if an ideal situation, as an employee, a new employee coming in, should be assigned a sponsor who can kind of orient you to the process.
Correct.
Might be your hospital medical administrative assistant.
It could be, absolutely.
But would be awesome if it was another acupuncturist, if it's like an acupuncturist supervisor. And that kind of, when you talk about sponsor, to me, that kind of almost starts that process of looking for a mentor in the organization, not necessarily as another acupuncturist, but someone who really knows how the organization works, may or may not be probably is part of the union, knows how the union works. And they can talk to you more about hours of work and leave and what is overtime and when from a union perspective, when you're being asked by your clinic to do more than is normal compared to other clinics. And so it kind of they talk about culture. So often there's a culture for that hospital, but then also the culture for what's normal for the hospital versus what's going on in your clinic. Because it could be an unhealthy situation going on in your clinic, and as a new employee, you don't have anything to compare that to.
Shocking, but not everybody in organizations play by the rules that they're supposed to, and so oftentimes unions can be your saving grace, because you can go to them and say, according to our handbook or according to our code of ethics, this is how we're supposed to do this process or this procedure. And by the way, it's codified. However, what's happening in the real world is vastly different. And that's where they can engage with the supervisors or with employee relations. I mean, obviously, you're always going to go to your supervisor first and say, hey, I'm seeing this trend where what we do kind of deviates from the standard operating procedures or from what's codified in some type of regulation. And then depending on the answer they get back, if you don't get resolution, you can go to the union and say, hey, I'm a little bit confused about this, or I have a concern if it's something a little bit more serious. That's an opportunity to update standard operating procedures or update policy and make sure that it matches what needs to be done in the real world. And if there's no gray area, why not fix that process or that SOP or that document to match what really is effective? Or it might be an issue where it's, okay, actually, we're doing things the wrong way and we need to rectify this.
Yeah. The example that comes to mind is more thinking about for what I often hear from other women who've had babies and gone through the maternity processes, because states, there's variation by states and what Family Medical Leave Act is versus maternity leave, and then the whole issues with childcare and getting time off for childcare, and all the different things that go on with that. Yes. And I find it seems to be common in management for people not to necessarily be updated with what's currently going on, because sometimes the laws are changing, and then the hospital might not necessarily have their standard operating procedure updated by what just changed for the state law. And then federal law might be different than state law if you're on a federal facility.
Right. So. And that's where you really have to rely on it and hope that you have a good human resources department and labor and employee relations department, because their job is to make sure that those policies are updated and make sure that they are constantly in communication with the union and making sure that things are in order and that people are not prevented from, taking 1 hour to nurse or to do their pump in a quiet, clean, acceptable, hygienic environment.
Not the bathroom.
No, not the bathroom.
That's against the law, thankfully.
Yes. So those are the type of things where, you want to make sure that everybody is in sync. And then, at some point you'll be a supervisor and you'll have to go through those courses to make sure that you're not infringing or impinging upon the rights of your employees. Yeah.
So we kind of talked about our outline, I think, for a lot of this. So a lot of that was kind of focused on if you're a new employee. But so if I'm a new manager, and I'm onboarding an employee, there should be resources for me as a manager for how to learn how to be a manager, right?
There are, and I think it's a little trickier when it's one thing to come on board and be an employee and be responsible for yourself. It's very daunting to come on to a new organization as a supervisor, especially if you're a brand new supervisor or you've been a supervisor in a very different organization, and you have to not only get familiar and know the new culture, but then you have to make sure that you are doing things the right way to serve your employees. And that's hard. I mean, it could be a very stressful time. That's something that I've done myself. And, I'm thinking, wow, it's exciting and great to come into this new organization, and they're very different. But, oh, by the way, I have employees that also need to be served in a way that is honoring their union agreements, their tariff agreements, making sure that I'm not overstepping my bounds, or I'm not just thinking, oh, well, my gut says this is right. No, I have to go and figure out what they are entitled to and make sure that that's being done. Yeah. So that's a whole different,
it's a whole nother
topic fish. Even. Yeah.
All right. So was there anything else you want to talk about related to onboarding today?
I'm just looking at our outline and I'm thinking, the only thing I don't think we really talked about was leave, which kind of ties into time and attendance. Again, that's part of culture.
Okay. So leave is
and vacation.
Taking time off and vacation, whether it's that you're sick leave for time being ill, well, whether it's related to Family Medical Leave Act or just vacation time.
Yes.
So, yeah.
So yeah, so just, tying into that whole getting used to the culture, making sure that you are taking leave and that you're not burning yourself out. How does the culture view leave? Is it like, oh, that person's not a team player because they want to take their leave that they're entitled to? Or are they like, hey, we want you to be healthy and happy and sound. Please take your leave. Please make sure you schedule it. And oh, by the way, you have a team of people you need to coordinate leave with. And so part of that whole leave picture is, how do you fit in? How do you request leave? And it is similar and related to time and attendance, but making sure that you also take your leave. Don't burn yourself out.
Yeah. Well, I remember working in hospital practice. This varies by organization, but it's great when they help pay for your continuing education classes.
Yes.
And so sometimes they'll help pay for the course, or they'll pay if it's part of your minimum continuing education that you need, not when you go above and beyond.
Right.
So you have to remember having to submit the information about the course, like the costs, the dates, the times, the location. So sometimes if they wouldn't pay for the actual course, they might pay for the travel to and from, if it was something that they were like, oh yeah, we really want you trained in this. Or usually if that's the case, they really want you trained in it, they'll also pay for the course.
Right.
And then sometimes that kind of leave for continuing ed can be allowed to not be counted as your regular leave.
Correct.
So it depends on what your agreement is with the hospital when you get onboarded.
Yes.
So make sure you're checking into that. Like if you get continuing education as part of your position, like if the physicians are getting that, it is highly likely that you as another healthcare professional, or if the psychologists are getting it, or the physical therapist, then you as an acupuncturist should also have that as part of your position description, right?
Yes. This is huge, and I'm glad you brought it up, especially for contractors. There are often times where you'll work for an organization, but you're actually working for a contractor. You're not a de facto employee of the organization. And so for contractors, it's even more important that your contract stipulates what you're entitled to and what will be paid for in terms of continuing education, in terms of annual conferences, travel, any type of leave that's directly related to your focus area. And so that's something that you need to have in black and white before you start your job, because the chances of you having it put in after the fact are probably slim to none.
Yeah. Yeah. So those of you who are really new to hospital practice, before you head in, make sure that you get to continuing ed as part of your benefits. So
that's definitely negotiable. Yeah. Definitely negotiable.
So and it's great when they don't count your leave time for continuing ed as part of your regular leave, especially if it's over a weekend. And then and sometimes some conferences we would actually instead of taking leave without pay as part of it, we would be getting paid while on leave, because we were actually there was a feeling like, well, you're working, you're learning,
correct,
instead of versus vacation where you're not working. So
there's definitely, in terms of education and keeping up your continuing education for licensing, this should all be part of that onboarding process. It should be clear before and when you get on board what you're entitled to. So whether you're a federal employee, whether you're working private sector, or you're a contractor, it should also state this is what you're entitled to. And there should be an individual development plan that's part of your performance management holistic system that tells what you're going to do in the near term and in the long term for things like continuing education, things that are required. And then also, if you work for a great organization, they may even pay for you to go to courses that have nothing to do with what you're doing at that particular organization, as long as you can show that there's a benefit to that. So for example, if you want to take some admin courses or some HR courses, if you can show them and justify why you need that, then that's something that can also get incorporated into your individual development plan or your education plan, or however your organization calls it. It's basically what you need to do to progress and be successful in that organization over a 1 year period, over a 3 year period, over a 5 year period. And it talks about on-the-job training, continuing education, and also a pursuit of different degrees, bachelor's, master's, associates.
So that gets more into career mapping, which we're going to talk about another time too.
Absolutely.
But and I really like when we do have time for you to talk a lot about career mapping. I really love this idea of how when you're at a workplace, is not just your job. It's about have that as part of your performance plan. Like, how do you grow as an individual?
Correct.
And as part of that organization, and that it's a fluid. It's a thing that allows you to grow. So, but I was going to go back to leave and continuing ed, and let's see, was it failing medical leave? Now I'm losing track of what I was going to say. But time.
Yes.
So like as a professional who does chart notes.
Yes.
And my time during the day, I need to be clear with my organization about when my chart notes need to be done.
Yes.
About if it's going to be during my time that I'm actually at work. I mean, obviously I have to use the computer system there, unless I get special permission to be able to use my CAT card to finish notes at home.
Right.
Which you can do. You just have to have a lot of extra paperwork because of make sure everything is HIPAA compliant and nothing, you're not exposing privacy stuff, protected health information, that's the word, protected health information. You have to be careful about that. So they have certain systems in place for you to be able to bring a computer home if that was something you need to do. But so a lot of times in peer record review, which is part of our performance plan, is we have to have our chart notes done within 48 hours.
Right.
If we're not, we're considered delinquent, and we start getting notices from the people who look at our chart notes and code them. Like, hey, and there's a reason behind that usually. Correct. Because the coders have to do their job to put in codes for the notes and all that. But so there's making sure you know what your time is for seeing patients versus getting your chart notes done. What's normal for other professions. If there's enough acupuncturists, like what's normal for the acupuncturist? If you're the only acupuncturist, what's normal for a similar hands-on profession like probably the physical therapist is the most similar, because they also have to do the diagnostic as well, though they often get assistance. So you try to find someone who works similarly to you. Sometimes physicians are not always the best example because they see patients differently than we do. So chart notes, time, and when we have to do training for the organization. So like I'm working at this hospital and they want me to learn how to be aware of internet phishing schemes in my email. So it's not anything related to my clinical work, but it's a required mandatory training I have to do.
Yes.
Should they be giving me time in my workday to do that, or should that? Well, how does that work out?
I'll give you the attorney answer. It depends.
Okay.
So ideally, you should have enough time in your day to be able to do your patient encounters and then do your charting and your follow-up. In addition, you are supposed to have time built in to do mandatory coursework. With DoD, they often, if you weren't in the hospital proper, if you worked in a clinic, there are often designated days where it was a non-activity day, or quote unquote. So it was kind of like a workday holiday. Yeah. So nobody's seeing patients, and that's the opportunity for you to catch up on things that are coming down in terms of deadlines for continuous education or your mandatory training for cybersecurity, that type of thing. If you're a contractor, again, you always have to refer to your personal contract that you have with that organization. And you should also become, if you have the ability, become familiar with the contract that your organization actually has with the clinic, because that also tells you what's right, what's wrong, because you may have a supervisor who's not your supervisor. They may be the floor supervisor telling you have to do certain things a certain way. And actually you have to go by your contract and by your organization's contract. And they may give you pushback. So you always want to make sure that you're abiding by the rules of your contract and your company's contract. They may not be wrong that you're due for training, but how you get it done is a different story. Typically you'll have a program manager or a contract manager on site that can assist you with interpreting when you should be doing certain things. But yes, absolutely. Part of your role as an employee is to give feedback in a gentle way that says, these are realistic and these probably need to be tweaked. If you're expecting me to see 20 patients a day, I'm not going to have time to do this mandatory cybersecurity course I need to do my charting, do my this, do my that. And by the way, patient care and satisfaction may suffer if I'm just, having one patient after another, and I don't have any time to do my wrap up work. It's just not going to fly. So there should be a consensus, and there should be, your clinic managers should have a good handle on what's a good spread of time between seeing patients, doing your charting and your required work, and then doing your training.
So as I'm listening to you, I'm realizing that we probably skipped over a really basic thing.
What did we skip over?
Something that we understand as military spouses is chain of command.
Yes.
So let's go back.
That is not unique to the military, but the term maybe.
So we use the term chain of command, and this is like knowing your place in the organization and who you go to when you need something, need information, or have a problem. And there is a line of command, whether you're federal or civilian. On the military side, we are extremely aware of our chain of command. But on the civilian side, there should always be a really clear command. And you should know what your structure is. So I'll just talk a little while you get some water. You should always know what your structure is so you know where your resources are. Because if you don't follow your structure as an employee, you can get in trouble and be disciplined just for not following your structure. And this is true on the civilian side, regular people side,
yes,
and the federal side. And the process obviously varies by organization, but you always need to know what your chain of command is, what your organization structure is. So let's start with an example. So I'm a new employee. I'm just a clinician. Who would be like the next person if I have a question or issue, who would be the person that I would go to?
So
first,
typically it's your supervisor. Typically your supervisor is going to be the one that you interact with day to day or maybe on a weekly basis. And they will be your guide on what you can and can't do, how you should go about bringing up things. There also may be open forums too. For example, oftentimes there's ways to give feedback that may be outside of the chain of command, but 99% of the time you're going to go to your immediate supervisor for guidance on anything you have a question about.
So usually I see Stephen just joined us. Hi, Stephen. So for Stephen as a clinician, he probably has a clinic manager.
Yes.
And who is the manager of his acupuncture program.
Right.
So he would probably go to that person first.
Correct.
And ask his manager about it. And then the person above his manager would be the program director.
Yes.
And then the program director probably reports to yet another level. And then that level probably also, there might report to another level, but at some point the highest person would be what we call the CEO, the commanding officer, but that's your person who is the director of the entire hospital. So there's levels that go up, and usually your department heads are kind of like the integrative medicine department head and the radiology department head. They're kind of all let's say their colleagues isn't quite the same. Like I'm thinking like in the Army system, they'd all be colonels, right?
Right.
So they're all peers. So all department heads would be peers. And so above them would be your hospital administrators or hospital directors. And that title changes a lot. So in military, it'd be your commanding officer. And then under them is probably a vice commanding officer kind of thing. But as a clinician, it would be my manager.
Yes.
And then if I had a problem with my manager, first I would try everything with my manager, right?
Correct. You want to have a conversation with your supervisor and say, here are my concerns, or here's where I feel like we're deviating from process or procedure. Do we need to update that process or procedure to reflect reality? Or do we just need to correct? Do we need to right the ship and make sure that we're doing what we're supposed to do? The other thing that kind of ties into that onboarding and getting used to the culture is knowing where you are in the chain of command and knowing how that chain of command is organized. So one of the best examples of that I can give is when I onboarded with the Army in Germany as a civilian. They gave me an org chart and they said, here's our major command, and here's the brigade level, and here's where we are at the particular center level, and here's how you fit into it. And so it was
how you fit into it.
Yes, and it was very clear to me who I would go to if I had a concern or a problem. And oh, by the way, if you have a problem or a concern that you can't bring up with your supervisor because they're the object of the grievance or the complaint or the concern, there are resources available like equal employment opportunity specialists or officers or human resource officers, management employee relations. It should be explained to you why you would bypass your supervisor in very, very, very limited circumstances and when that's appropriate.
Okay.
Especially in cases of, if you feel there's discrimination or sexual harassment or hostile work environment, there may be reasons where you would bypass the supervisor, especially if that were unfortunately the person that may be suspected or you've observed doing that.
So if I feel like my immediate supervisor is sexually harassing me, and I've actually talked to them and be like, hey, no, this is not okay.
Right.
And I feel like they aren't responding, and I'm tired of it. And I want to know, well, who do I go to next?
Right.
Who do I go to next without like being in getting myself in trouble and wanting to lose my job because there's something that's not right. There's something going on that's not right. And I want to keep my job because I love my job.
Right.
And I want to stop this thing that's not right. And so in theory, when you're onboarded, you should be told like what is the process for going around that. And some organizations have really specific programs for sexual discrimination. There's really specific programs for racial discrimination or ageism. Yes. Believe it or not.
Welcome to the over-40.
Is that all part of the Equal Opportunity Office? Is that what you were talking about? Is that what it's called?
So on the federal side, it's separate but related. So for example, EEO is dealing with discrimination on different levels and different types of discrimination because of your national origin or your perceived national origin, your gender, your sexual orientation, things of that nature. And then on the harassment side, you're talking about sexual harassment, especially in DOD, or Department of Defense, there's specific counselors and agents that you can go and speak with confidentially in order to file a report against a civilian, a contractor, or a uniform service member. So there's very well-defined maps of who to go to. And again, if you find yourself confronting these issues, this is where having a sponsor or having a mentor really comes in handy, because when you're in the middle of a situation, you may not be able to think clearly because you're under so much stress. And so they can really be a guiding light to get you to the appropriate resource that's going to assist you. Yeah. And hopefully at the lowest level possible, that, everybody's happy at the end of the day and things can get fixed.
Yeah. Awesome. All right. Do you guys have any questions for us? I mean, we talked about a bunch of stuff today. This was just part one of our impromptu outline about performance management and how to be a new employee, or if you're a manager, some things to know about in an ideal situation with Sondra. So we'll do this again at least one more time. Yes, maybe a few more times. But would love to have your questions. You guys can ask over the next 5 minutes when we talk a little bit, and then we'll probably end this. And then if you want to keep asking after the live thing has ended, we'll kind of come back and try to answer them next time. So as we're kind of waiting for questions, if anybody has a question, like any resources that you can think of off the top of your head that you'd recommend for today?
Absolutely. So for example, if you work in a federal environment for a federal organization, there are typically tons of resources about the organization, about onboarding. There's Facebook sites for your organization. So over here in Tennessee, we have Naval Support Activity Mid-South, and they have a Facebook page.
Let me say, so we live in Tennessee, we're currently in Tennessee, and the region is called Naval Support Activity Mid-South. So that was that whole...
Yes, kind of a tongue twister. But basically, if you work for the Department of Defense, your local organization will typically have resources galore on their SharePoint sites, on their Facebook site, you can even Google things. The other thing that you can do is just get in touch with, there's also employee assistance programs. So for example, if it's something where you're just kind of stressed out and there's nothing toxic going on in your environment, or you may just be going, as military spouses, we move all the time. There's a lot of uncertainty. Yeah. And maybe it's just weighing heavy on you, but you love your job, you love your coworkers. Department of Defense offers, and many federal agencies offer, an employee assistance program. And so you can call and you can actually talk to a licensed mental health counselor. Typically, they give you a certain number of visits that are free and confidential.
Oh, cool.
And so it's a fantastic underutilized resource. If you're a military spouse, there is Military One Source.
Yeah, I love Military
which is a great resource. And they do a lot of career planning and resources, and they do a lot of connections with education. So, I mean, there's a wealth of information, but I would say for sure, use your organization's Facebook as your first point of research, and then Google anything about your organization, because you'll find so much that you won't even be able to sift through it all.
Awesome. Cool. All right. Well, thank you guys. We're going to sign off for tonight. And thank you again, Sondra. I learned a lot. So
thank you.
Thank you very much. So take care.